the biggest challenge that we have in pulmonary rehab today is access to care. There just aren't enough rehab programs throughout the country, and then for those rehab programs that do exist, there's not a lot of reimbursement that we get from third-party payers or from CMS to warrant the initiation of new programs. So people who really need care that have chronic lung disease are often left in the lurch because there aren't enough rehab programs out there to provide that service. I think the non-pharmacologic approaches are of vital importance for people that have chronic lung disease. Certainly we know that flu vaccine should be given to every patient that has chronic lung disease. We also know that through many, many years of research, and maybe even more research in the field of pulmonary rehabilitation than in any of the medications we use, has been shown to be very, very effective to reduce shortness of breath, improved health-related quality of life, improve dyspnea or reduce dyspnea, and also to reduce healthcare utilization in patients that have chronic lung disease after they've been through a pulmonary rehab program. So if you had to look at these different things, the non-pharmacologic approaches are really a mainstay and should be a mainstay of treatment for people that have chronic lung disease. The biggest thing about pulmonary rehab programs are, number one, referrals into rehab programs. So we really need to educate our primary care, the patient's primary care provider, that rehab is an effective component to the management of that patient overall. And then once a patient is in a rehab program, getting them to change their behavior lifelong is a very, very important process. It's been over about the last decade that we've really been looking at how patients can look at their own self-management skills, what we call, or self-management promotion, that these patients can then change their behavior and improve their quality of life for lifelong. The non-invasive open ventilation system is a very important part of the management of some people that have COPD. We did a study several years ago where we looked at the use of non-invasive open ventilation in the home environment, where we had people in their home, they did activities of daily living, and then we were able to show, it was not a randomized, not a controlled, it was a controlled study, but not a randomized study, and we were able to show that people would be able to do more in regards to their activities of daily living for those that were on the non-invasive open ventilation compared to just being on oxygen alone. So I think it's an adjunct to the other types of therapies that we have available and should be considered in certain patients. Really, someone that has chronic lung disease or any chronic lung disease should be involved in a multidisciplinary care program that is going to afford them the best and optimal outcomes. For example, utilizing respiratory therapists, utilizing nurses, utilizing case managers, utilizing nutritionists, physical therapists, occupational therapists, psychologists, all need to be part of this chronic care management program, because we've known and we've shown that over many, many years that getting the whole team involved is a very, very critical aspect of managing that patient long term.